In 1886, Reginald Fitz first described this condition, a common abdominal emergency for surgery. The appendix is one of the abdominal organs. It is found on the right lower side of abdomen, but in some people where there has been a malrotation, their appendix can be on the left side although rare. The appendix vary in its position, in different people, in some, it hangs into the pelvis and in some behind the cecum. Things such as fecalith, worm, virus and undigested foods, and increase the size of the lymphoid are thought to cause obstructions of the appendix. When obstruction occurs, bacteria grows inside the appendix. Later, the appendix distends due to increased pressure. This interferes with the lymph and blood flow. This can result in necrosis and even perforation. Very common in the westernized community. Common in people below 30 years but very common in people between the ages of 10 and 19, and it is very common in men than in women. The most feared complication is when it perforates. On today's video, we look at signs and symptoms. The patient has an obstructed appendix. At first, the patient notices changes in his or her bowel habits, body weakness, some crampy pain around the umbilicus. About 12 to 24 hours later, the pain migrates to the lower right side of the abdomen and becomes sharper. Then the patient experiences nausea and vomiting. Nausea and vomiting comes after abdominal pain, not before the abdominal pain. Another common symptom is that the patient becomes anorexic. Absence of this symptom may even result in questioning if he or she has blocked appendix or not. The patient might want to lie still or avoid discomfort situations such as sneezing, coughing and bumpy car rides, since the pain will come about as a result of peritoneal irritation. In some patient, they might experience pain during urination, increased frequency and even diarrhea. When pelvic examination is done, he or she might have suprapubic pain. In some people, pain is felt on the left lower side, due to malrotation of the appendix or even severe redundant colon. In pregnant women, the pain can be felt on the right upper part of the abdomen instead of the lower part because of the growing fetus. Apart from pain from the lower side of the abdomen, pain can also be held on the lower right back, especially if the appendix is on the lower side of the cecum. When the patient applies gentle pressure on the left side of the abdomen, he or she feels pain on the right side. If he lies down and tries to rotate his right thigh, he feels pain on the lower right side of the abdomen. If you try to extend his hips, he also experiences pain on the lower right side.